Okay, Sarah, so you purchased this thing in your second attempt. This was very expensive. What exactly is this? Tell us.
So these are dental loupes from Orascoptic, and I got these for my second attempt. They usually, you have to book an appointment with the representative. I think the name is Deb, if I'm not wrong. And then they come to you, they visit you, they get all the measurements done for you, and then they make one for you.
All right.
Yeah.
So, first of all, are they required for you to appear in ADC Part 2?
So these are not mandatory. It entirely depends on an individual. If you want to have loupes in your exam or not. But having said that, even if you want to have loupes, you should first get used to of the loupes. So I would recommend, if you want to wear loupes in the exam, purchase them at least like 6 months beforehand, so that you can get used to of the loupes. It took me around a month to get used to of these loupes.
And what do they do?
So they magnify. These are like 2.5 times a magnification. So they magnify the teeth, the area, and also helps with the posture.
And how do you wear them? Can you
It's
show?
simple. These are like, I've got the light as well here, which is supported by the battery,
Right.
which I've got here. They give you 2 batteries. So you put it here, and then you just wear it like this. Yeah. And then you can tighten at the back.
Okay.
And you can adjust the light accordingly, and then you can do your work. See my posture. I am so far away from the patient that I can do everything.
All right.
Yeah.
So without loupes, what is your posture?
So sometimes you don't notice it, but you get really close to the mannequin, and that's when the examiner will come and tell you that you are really close to the mannequin.
Right.
And yeah, you should improve your posture.
All right. Can you show it to me? Okay.
Yeah.
So now you didn't use it in the first attempt, right? But you did it in the second attempt. Why is that?
Because as I said, in my first attempt, I didn't practice all the tasks with the loupes.
Right.
So I was just using the simple eyewear. I'll show you. These are the ones that I think everyone uses. These are the ones that I was using in my first attempt. But then I thought that I will be getting loupes in the future when I will clear my exam, and I'll be practicing in the clinic. So why not? I would get one.
Okay, so you can use that in the clinic as well?
Yes, absolutely.
And do you need to use them in clinic?
Yes, because now I am used to of these loupes.
Right.
I prefer working with the loupes. I cannot work without loupes.
Okay. And do you know of anyone who has cleared the examination without the loupes?
Yes, many of my friends have cleared it without
Right.
loupes. But once they have cleared the exam, they bought the loupes for the clinic. Yeah.
All right, because if you're working as a dentist, you would need these anyways.
Yes, it helps you actually
Right.
in all the tasks, in the work setting, I would say. Not every dentist wear loupes. I know that because I worked as a dental assistant. But most of the dentists do.
Right. And so you can hold this now.
Thank
All
you.
right. So what does it cost?
It costed me around 2,300 Australian dollars, if I'm not wrong, and they gave me a student discount as well, and I paid it in installments, which was like 6 month free, interest free rate. Yeah.
All right, but still pretty expensive.
Yes, it is. It is like an investment.
Right.
Yeah.
So if a student thinks that they could do their work without the loupes, is it okay for them to appear in the examination without the loupes?
Yes, they can.
Yeah.
Okay, but if you can afford the loupes, I would say just go for it.
Right. But if someone is appearing for the examination after 2 months or 3 months,
Yeah. See, as I said, that you have to first get used to of these loops. So as I said, that if you're thinking of buying loops, then at least buy 6 months before the exam, and then practice with the loops. And I know once you'll get used to of the loops, you just cannot work without it.
And you cannot just borrow it from someone and work on this.
I don't think so, because what I felt once Deb came to visit me for all the measurements that she took for me, I think they customize it individually.
Right.
Yeah.
And is there any specific model that we need to purchase or that's recommended, or is it like one?
I think this is the very basic, that's the starting range, which is 2.5 times.
Right.
This is the box that they have given me. You can see the details, but
This is
there
RDHD.
are there are more higher magnification as well, like 3.5 times, 4.5 times. But see, you have to first get used to of the lower magnification. Then you can, I think, move to the higher magnification.
Okay. And you talked about battery and the light. Does it comes with the loop?
Yes, they usually ask you whether you want light as well on your loop. So I said yes.
Yes.
And then then they add the charge of it.
Okay.
Like the price of it.
So the price without the battery would be a bit less.
Yes, it would be less, but they provide 2 batteries.
Okay.
And they say that they run for like 3 hours if you charge it properly, like
Right.
completely. And yes, they do.
So in your examination, you had to change the battery.
Yes, so one battery ran for 3 hours. It didn't stop,
Right.
but then I changed it after lunch.
Okay. What was the name of the company again? Can you show?
Yeah, so it is Orascopic.
Okay.
Yeah.
That's good. And are they paying you anything for promotion?
No, not at all. It's it's just
Are there any other brands as well?
yes, there are many. There are
Okay.
many. You can do your research, and you can go with any of these.
Okay, just final
Which are
question.
available.
How much time did it take from when you ordered to actually get the loops?
I think because that was the time of COVID, there was a lockdown everywhere. When I purchased these, it took a month or 2 for these loops to come to me.
All right. Thank you so much.
Thank you.